I'm the owner of the company Erita Trainings. My company was founded in 2010 with training for everyone for whom the desire and improvement rather professional life is very important. I have medical and cosmetology education. I also reflexology and acupuncturist. I work at neurological and psychiatric clinic. 7 different episodes of Schultz training for each day of the way. Dr. Schultz is mental training will bring you full and strong relaxation in the morning, in the evening, or during work as you prefer. You will calm down, you will be full of energy and rested. You will have new strength to act. You will be completely relaxed after training. You will feel reborn. After half an hour of Schultz training every day of the week, you can listen to each episode every day because there are 7 episodes. You can listen to everything other day or only when you want to relax or are stressed. After half an hour you will feel relaxed and you will feel a change in treating yourself after the few days. Motivation will be absorbed deeper and deeper into your mind. The training is also supposed to create good, very pleasant feelings in every listener. Training will increase your self-confidence, increase the efficiency of your body and mind. To deepen your self-confidence, peace of mind, increase your motivation, increase your motivation, increase your your muscles of the body. Bring the mind to correct thinking. Schultz training is also just for people who want to get out of depression, for people with anxiety and panic attacks. Training effectively removes these feelings. When treating neurosis or anxiety attacks, it is recommended to listen to Schultz training daily for about 3 weeks. First, I will put you relaxed mood. Right after that, you will begin relaxing all the muscles in your body. Then you will deepen this relaxation strongly. I will introduce you to a nice tour that work on your subconscious mind. So this is relaxes that you feel good, relax and self-confidence every day. Then you will breathe evenly, completely, and then you will feel the body warm. When your mind is completely relaxed, you will say to gently stand up or open your eyes. Training are for everyone, for older people, for younger people who don't want to get sick but enjoy a mental and physical condition. If you want to increase and self-worth, if you want to feel wonderful and perfect every mind, training is also recommended for businessmen for improve their concentration, self-esteem and motivation, as well as relaxation for students and for everyone who lives in a hurry. If you would like to distress and invite, if you want to feel the relaxation of your body and psyche, if you work professionally, if you want increase your self-worth, if you want to feel wonderful and perfect, please follow up my course. After its completion, you will get a certificate.
We will begin with a relaxing back massage. First, put the oil on and rub it all over the back and on the base of the neck. Use as much oil as you need. The more oil you have, the easier it will be to massage. Of course, don't use too much so that oil doesn't drip down the body. Start by massaging the neck. Stress is located at the back of the neck. The more stressed a person is, the tighter their muscles will feel, which can often cause hair loss or headaches. Remember to massage the entire back from time to time so that the patient being massaged will feel warmth on their body. Pay attention to the position of the hands. Put one hand on top of the other when massaging the spine. Massage the right side of the back with the right hand and the left side of the back with the left hand from the lower back up to the base of the neck. Use the knuckles of the forefinger and middle finger like the letter V and run along the spine as shown in the film. Keep the fingers spread so that they don't touch the spine. Make several such movements to relax the paraspinal muscles. Then rub one side starting from the spine moving outward. Now use both hands and make circular movements. Place one hand on the other and massage across the back from the spine around the shoulder blade. Move to the opposite side of the patient and repeat these motions for the other side of the back. Always stroke and rub from the spine to the outside and around the shoulder blade. Use 2 hands from the spine to the armpit line. Repeat these movements several times. Next, rub from the spine outwards around the scapula, alternating clockwise and counterclockwise using both hands. Repeat these movements several times. Now stroke both sides of the back from the spine to the outside using a pushing motion and alternating left and right hands. Place both hands on the patient's back and make wide circular movements all over the back. You may massage with your forearms, stroking the entire back with them using a back and forth motion. And again, massage around the shoulder blades in a circular motion. Now we begin with a stronger rub. We make movements from the spine to the outside. Remember that 2 hands should be on the patient's body at all times. Rubbing results in strong relaxation of the muscles. Never make these movements on the shoulder blade, only around it, and do the same for both sides of the back. Massage alternately from the spine across the back. Pay attention mainly to the paraspinal muscles. Then stroke the entire back. Bend the first two fingers of one hand and knead the paraspinal muscles using the knuckles. Then hold that hand with the other hand and slide the knuckles down the spine. Remember that the fingers should be close to the spine, but never on the spine. Repeat this same movement several times. This movement is very relaxing. Perform a massage with the forearms on one side of the back and then the other side of the back. Now gently stroke the entire back. Start the kneading movement by kneading along the line of the spine. Focus on one side of the back. Repeat this movement several times. Gently massage the back to relax and warm it up. Make cross-stroking movements on the entire back. Now position yourself behind the patient's head. Massage the neck muscles, rubbing the paraspinal muscles down to the lumbar region. Rub the spinal muscles continuously. Then go back to the cervical region. Repeat these same movements. Stroke the entire back to warm it up. We stroke along the spine and outward from the spine. Then perform vertical rubbing along the spine and massage with one hand over the entire back. Use your hands along the spine in a stretching motion. During the massage, ask the patient how they feel, if they are comfortable. If they're comfortable, keep massaging. Stroke the spine with both hands, and then make circular stroking movements on one side of the back. Go to the other side of the patient and perform alternate transverse strokes. Repeat this movement several times. Use both hands. You may also use the forearms. Stroke and rub the muscles. Stroke around the shoulder blade. The other hand should always be on the patient's body. Always move from the spine to the outside. Massage the other side of the back around the shoulder blade from the spine to the outside. Massage the entire back. Now I'll show you the correct execution of the shake motion. Use two hands to relax all the muscles of the back with this pattern of movement. Make this movement along and across the back. Do the same with both hands. Position yourself behind the patient's head and with both hands repeat the shaking movements over the entire back. Start at the forearms and then return to the back. Gently stroke the back with both hands. Now make an 8 pattern movement by working both thumbs into the spaces between the vertebrae. Bend the fingers in a letter V and run the knuckles over the paraspinal muscles. Now rub with the knuckles from the spine outward in a circular motion, moving down the spine. Do this in several cycles, increasing the size of the circular motion. Lightly rub the back and then make shaking movements with both hands. Position yourself behind the patient's head and then repeat the shaking motions with one hand. The other hand is always on the patient's body. And then repeat the shaking motion with both hands. Press the neck muscles with the thumbs of both hands. Rub the paraspinal muscles with your thumbs along the spine and from the spine to the outside. This movement should be performed on each section of the spine: cervical, thoracic, and lumbar. Stroke the entire back. Stroke the spine with both hands alternately. Make circular movements with both hands from the spine to the outside. Now make the stretching movement of the muscles along the spine. Do a cross stroke with both hands from the spine to the outside in a circular motion. Finally, massage using the wrists along the patient's spine. We perform transverse strokes of the spine, and in this way we finish the massage. Place both hands on the patient's back and make wide circular movements all over the back. You may massage with your forearms, stroking the entire back with them using a back and forth motion. Rubbing results in strong relaxation of the muscles. Never make these movements on the shoulder blade, only around it, and do the same for both sides of the back. Start with a relaxing head and face massage. The patient should lie quietly and begin to relax. Put light pressure on the top of the head and on the temples, then move to the back part of the head. Make circular movements with the fingers. You may increase the pressure to relax the patient even more, but not too much. Rub the sides of the head, spreading the fingers wide and using more pressure. Wrap your hands around the head and massage the back part of the head. Now massage the top of the head with your thumbs. Repeat these movements several times. The pressure should be strong enough to relax the patient, but not so strong that they feel discomfort. Move on to cleansing the face with makeup remover. Warm the oil in your hands and put it on the patient's face. Remove the excess amount with a tissue and start spreading the oil all over the face, on the forehead, cheeks, and nose. Start gently stroking the forehead with 4 fingers of one hand. The pressure should be strong enough to make the patient relaxed. Make circular movements around the eyes, nose, and chin. Make eyebrow pinching motions. Move to the forehead. Spread the first 2 fingers of one hand and move them across the forehead. Make circular motions with the index finger of the other hand across the forehead. Rub the forehead with 8 fingers. Movements should be more gentle, passing over the temples. Massage in circular motions. Massage the circular area around the eyes. Massage the lower part of the face, then return to massaging the forehead. Perform transverse and longitudinal rubbing on the forehead. Move on to stroking the forehead. Rub the forehead with 1 finger as shown in the film. Focus a lot of attention on the forehead because this is where stress accumulates. Proceed to massaging the temples. Use light pressure and kneading. Stretch the index finger and middle finger of one hand over the temple and make circular motions with the index finger of the other hand, just like in the film. Do the same on the other side. Massage the cheeks, rubbing them with 8 fingers. Move on to the chin and jaw. Now we stroke the eyebrows. Put your hands on the patient's face. Massage the entire face. Move to the forehead. Hold one hand on the patient's head while rubbing the forehead crosswise with the other hand using 3 to 4 fingers. Make pleasant circular motions. Rub the forehead with both hands in several cycles. Now start at the place between the eyebrows and rub the entire forehead with both thumbs. Repeat the eyebrow pinching motions. Trace the circular area around the eyes from the base of the nose to the outside. With the first 2 fingers of one hand, make the letter V across the temple and massage the temples with the index finger of the other hand. Repeat the same procedure on the other side. Once again, move on to rubbing the forehead muscles. Massage using 2 thumbs. Move on to the temples. Place the right hand on the right temple. Place the left hand on the left temple. Stretch the skin at the temples. Massage the nose is based on gentle movements. Make them using your 2 index fingers starting from the base of the nose to the wings of the nose. Then massage the circular area of the eye and nose. Place one hand on the patient's face while the index finger of the other hand massages around the eye. Use the index finger and middle finger to stretch the facial muscles. Do the same for both sides. Proceed to rubbing the cheeks with both hands. Massage the circular area around the mouth. Then move to rubbing the chin. When making motions with one hand, the other hand must be on the patient's face. Move on to massaging the lower jaw. Pinch it with 2 fingers just like in the film. Massage the lower jaw, moving higher and higher. From time to time, rub the patient's face with your hands. Use stronger pressure on the sides of the face. Make a shaking motion all over the face to increase the feeling of relaxation. Rub the cheek and chin muscles with slow movements. Rub the temples with the base of the hand and massage the jaw again. Move on to transverse stroking of the forehead with one hand while the other hand touches the forehead. Use the index finger of one hand to rub between the middle and index fingers of the other hand. Rub vertically on the forehead, applying pressure to the forehead and compressing with the fingertips on the forehead, temples, cheeks, jaw, and chin. Rub the chin and the lower part of the jaw with both hands. Move on to the cheeks, rubbing them with both hands. Then rub each cheek with one hand while the other hand remains on the patient's face. Massage the nose from the base to the wings again. Press on the forehead with your index fingers and increase pressure during vertical motions. Perform transverse rubbing of the forehead with one hand. Stroke the muscles of the circular area around the eye and mouth. We do this with the index and middle fingers of both hands. Do a chin rub and stroke the jawbone. Stroke the forehead vertically and then horizontally. Make the movement of pinching the eyebrows and stretching the temples on both sides with the methods already presented. Rub the muscles of the entire face with both hands. Make stroking motions on the lower part of the face. Stroke the cheeks with your whole hand. Stroke the entire face with 4 fingers. Rub and press the middle of the forehead at the base of the nose. Gently stroke the entire forehead with both hands. Put both hands on the face, and this way we've finished the massage. Stretch the index finger and middle finger of one hand over the temple and make circular motions with the index finger of the other hand, just like in the film. Do the same on the other side. Repeat the eyebrow pinching motions. Trace the circular area around the eyes from the base of the nose to the outside. Bend the first two fingers of one hand and knead the paraspinal muscles using the knuckles. Then hold that hand with the other hand and slide the knuckles down the spine. Remember that the fingers should be close to the spine, but never on the spine. Repeat this same movement several times. This movement is very relaxing. Hello again. Today we will learn a relaxing massage for the front part of the body. I have made a separate video on this so that you can learn and memorize the movements you need to make. A relaxing massage is, first and foremost, a massage that allows the patient to relax, so the movements must be gentle and pleasant. The patient must feel warmth on their body. Apply massage oil, gel, or possibly a massaging lotion. For a relaxing massage, talcum powder is not used as it is with classic massage. Apply the right amount of oil. You may enrich the massaging oil with an aromatic oil. You will need to put the oil on the entire front of the body. At the beginning, cover the patient's underwear. It is recommended to use disposable towels to keep the linen clean. Perform a circular stroking motion around the navel and then stroke across the abdomen. You may also use your forearms. This is a very pleasant feeling for the patient. Massage the abdominal muscles with the forearm, but do not apply too much pressure. Do not massage the abdomen strongly. There are internal organs that are not protected. All movements on the belly are made gently. Now make a circular rubbing motion around the navel. Spread a little oil on the ribs and rub them. Position yourself behind the patient's head. This is the best way to massage the neck and cleavage area. These areas are also massaged during a relaxing massage. Rub these areas gently. Treat the body as a whole. Transition smoothly from the stomach to the legs and from the arms to the hands. Now we massage the arms. Remember that if one hand is massaging, the other must be on the patient's body. In each massage, both hands must be on the patient's body. Perform gentle stroking. Enhance these motions with light pressure. The combination of gentle pressure and stroking is the most relaxing. Remember the frequency of your movements, which should be slow. Massage should be performed slowly with continuous movements. From time to time, we have to massage the patient's entire body so they feel warmth and a pleasurable sensation. The room should have a suitably warm temperature. The patient should not feel cold. The patient should keep their eyes closed so they can relax as much as possible. Advise the patient to contemplate the silence and focus on your touch. If the patient wants to talk, then talk to the patient. We act in a way that the patient feels is the most pleasant. Rub with 3 fingers of one hand around the navel. Always make this motion in a clockwise direction. The other hand will not make any movements, so it must be on the patient's body. Perform star-shaped stroking. Arrange your hands to make a star horizontally, vertically, and diagonally as shown in the video. This is how we rub the abdominal muscles. Stress is located in the abdomen. Do a circular massage on one side of the abdomen, then the other side, and the rib line. Perform gentle rubbing on the front part of the body in the armpit line. Now stroke again. We can do this in 2 ways. The first way is to massage with the dorsal side of the hand, as shown in the video. Or the back side of the hand. Either technique is suitable. The feeling of each movement is different. Perform vertical rubbing motions on the abdomen and part of the chest. We do this using both hands, on one side of the abdomen and then the other. Now perform a transverse rubbing motion of the abdomen. Perform this movement from the navel to the outside on both sides of the abdomen. Rub both sides of the abdomen circularly with both hands from the navel to the outside. Now use your forearms again to stroke the surface of the abdominal muscles. The next motion is kneading. Use both hands here. Massage the area that has been treated with oil and then begin massaging the legs. Start by stroking the thigh in a circular motion. Now perform alternating strokes of the thigh with both hands. Stroke horizontally, vertically, and in a circular motion. You may also stroke using the back of the hand. You may also use the forearm for this massage. Each movement is relaxing in a different way. It is best to use many different movements here to relax the patient as much as possible. Resume the kneading technique. Never use strong movements and pressure in a relaxing massage. Rubbing is a technique that leads to tissue hyperemia. It is needed here. Make circular motions around the knee of the other leg. Start with the thigh. Then perform vertical stroking around the knee. Do not perform relaxing massage on the knees or in the knee pits because there are many blood vessels and nerves here. Now focus on the right calf and make a circular stroking motion using both hands. Repeat this technique for the other calf using both hands. Resume massaging the entire body. You will often return to areas that have already been massaged. Massage them again. Also remember to have a positive attitude. Your posture should be comfortable enough so that your spine isn't strained. For massage, use the strength of your body, not the strength of your hands. You may also bend your legs at the knees, which will relieve pressure on your spine. Your smock or clothing used while performing the massage should be comfortable enough to perform the massage in a way that is also comfortable for yourself. Again, stroke the abdominal muscles and stroke the lower part of the chest in a horizontal direction. As one hand moves out from the navel, the other does the same. Massage both sides of the abdomen. Now do a slow stroking motion of the abdominal muscle in a clockwise direction. This movement is called running. Knead the abdomen itself horizontally, vertically, and in the shape of the letter S. Again, perform a dorsal stroking of the abdominal muscle with one hand. When massaging the front part of the body, focus your attention on the abdomen. The stomach, buttocks, and neck are the most tense during times of stress. Here, only an abdominal massage is shown, since the buttocks and neck massage have been covered in another section of the course. Massage the entire arm. Now massage the arm with one hand while the other hand is on the patient's wrist. Just as with the knee, don't massage the elbow because this is where many blood vessels and nerves are. Position yourself behind the patient's head and rub their neck and chest muscles. Rub the entire length of the arm. Treat the body as a whole. Warm the patient's body. Your hands become warmer during the massage, which gives the patient additional pleasure. Now perform the shaking motion on the muscles. This is usually done using both hands. Shake all the muscles on the front part of the body as shown in the video. Massage continuously. Remember to treat the body as a whole. Transition smoothly from one part of the body to another. Always make strong, stroking motions after shaking. Finally, focus on the abdominal muscles. Massage in a circular pattern around the navel in a clockwise direction. This is how we finish the massage. Massage the abdominal muscles with the forearm, but do not apply too much pressure. Do not massage the abdomen strongly. There are internal organs that are not protected. Perform star-shaped stroking. Arrange your hands to make a star horizontally, vertically, and diagonally as shown in the video. This is how we rub the abdominal muscles. The patient should keep their eyes closed so they can relax as much as possible. Advise the patient to contemplate the silence and focus on your touch. If the patient wants to talk, then talk to the patient. Begin the massage of the back side of the body. The patient must be lying on their stomach. Warm up the oil in your hands and apply it to the patient's back. Rub the oil thoroughly all over the back. Use as much oil as needed so that the body is properly covered. Spread the oil over the entire back of the patient's body. Start to massage the calf. Gently rub around the calf. Do the same on the other leg. Delicately rub around the calf muscle. Both hands should be touching the patient's body. If one hand isn't moving, remember that it should still remain on the patient's body. Stroke the knee fossa. We never massage on the knee because there are blood vessels and nerves there. Then we massage all of both legs so that the oil is spread evenly. Treat the body as a whole. Transition to massaging the back. Stroke the entire back. Stroking crosswise motions with both hands from the spine outward. Also massage the shoulders. Go back to the legs. Rub the calf lengthwise with both hands. It is a very pleasant and relaxing experience for the patient. Make a circular stroking motion of the calf. As you can see in the video, we rub the whole calf. Now make transverse stroking motions of the entire lower leg. Move to the other side. Massage the lower leg and stroke the thigh and calf crosswise. Remember to avoid the popliteal fossa. Massage the leg with the whole hand. Do this using both hands. Massage the leg with the whole hand, placing the other hand on the patient's foot. Start the back massage. Rub the oil and stroke the back crosswise from the spine to the outside. Repeat this movement several times. Make circular movements over the entire back as shown in the video. Massage the leg. The other hand is always on the patient's body. Return to massaging the back. Make large stroking movements. Use the aforementioned transverse stroking of the back, which relaxes the muscles and calms the nervous system. Now, with both hands, massage the back in a circular motion. Then perform alternating strokes across the entire back. Begin a rubbing motion along the spine with both hands, one on each side of the spine. We make these movements in several cycles. Then do the same on the other side of the back. Rub alternately with your hands. Then stroke the entire back with both hands. Stroke the lower leg to warm up the patient's body. Stroke the thigh in a circular motion and move to the calf. Do the same on the other leg. Begin rubbing with both thumbs. First, do this along one calf, and then do the same along the other calf as shown in the video. Massage both calves, making sure that both hands remain on the patient's body. Now make a rubbing motion on the right thigh, and after a while, move to the left thigh. Massage both legs. Start to slowly massage the back, making stroking movements with your forearms. We can make these same movements in a circular way, as well as alternating circular motions from the spine to the outside as shown in the video. Never make these movements directly on the spine. Begin stroking around the shoulder blade. The other hand should remain on the patient's body. Do the same around the second shoulder blade. Move on to the shoulder massage. Perform a transverse rub on the right side of the back with both hands. Make the same movement on the other side of the spine. We stroke the patient's back again from the spine to the outside with both hands alternately. Make a circular motion of stroking the entire back. Transition smoothly to the legs. Rub the calf with the middle phalanges. Proceed to rubbing the thigh in several vertical cycles. Do the same on the other leg. Massage both legs. Stroke both legs crosswise. Move to stroking the back in a smooth transition. Do cross-stroking motions on both sides of the back, from the spine to the outside. Massage all parts of the back, the lumbar, thoracic, and cervical. Go back to the legs again and stroke them with both hands. Stroke the entire back with both hands. Then perform rubbing motions with one hand on one side of the back. Remember to avoid the shoulder blade. Do the same on the other side of the back, moving from the spine to the outside. Repeat this movement several times. All movements are always from the spine outward. Massage both sides of the back from the spine to the outside. Then alternately stroke the back with both hands. Repeat this movement several times. With both hands, rub one side of the back and after a while, the other side of the back. Make a letter V with the second and third fingers of one hand as shown in the video. Move along the spine, but not on the spine. We knead the paraspinal muscles with the second and third fingers. Again, massage the entire back crosswise. Then massage the legs. Rub the calf. Move to the other leg and rub it as well. Perform the movement of kneading alternately between one leg and the other. Begin to massage the back in a smooth transition. Make extensive stroking movements followed by shaking movements. We shake the back muscles to relax them even more. With both hands, shake the back muscles and the legs. This is how you finish the massage. Hello, Here we will observe a combined relaxing massage of the back and front part of the body. For women, unfasten the bra so that you can freely massage the muscles of the back. Cover the patient's underwear with a towel so that it stays clean. Spread the oil over the whole body, on the back, buttocks, lower limbs, and base of the neck. It is best to spread the oil with a stroking motion using both hands. Make large, deliberate motions over the entire area. Make a cross-stroking motion on the back. Each hand should move from the spine outward. This is called the 8 movement. Go between the vertebrae with the thumbs. You should feel the vertebrae. Bend the first 2 fingers in the letter V and run them along the paraspinal muscles. Never make this movement on the spine, as it could be harmful to the patient. Put pressure on the paraspinal area using the fingers. Cover the whole area, the entire back, with warm hands. The more often you do this, the more comfortable the patient will feel. Remember that the movements should have light pressure. The pressure shouldn't hurt, but it also shouldn't be the same movements. Stroking relaxes the muscles. Make a cross-stroking motion on the back. Part the back from the spine outward. This is a very pleasant feeling for the patient. Make a shaking motion on the back. When making the shaking motion with one hand, the other hand should be on the patient's body. Stroke the back with both hands. Now stroke the patient's back in a circular motion and massage the paraspinal muscles. Remember to always make these motions from the spine outward. Now with light pressure, massage the neck muscles. Again, stroke the back crosswise. Every touch of your hand should be very pleasant for the patient. Now move to massaging the arms. Then the buttocks. Stress is located in the buttocks. We tighten our buttocks when we feel stress and when we focus. The buttocks are relaxed during this massage. Do this with the whole hand and also with the phalanges as shown in the video. This means curling the fingers and massaging the middle part. Always massage the buttocks from the center outward. Lightly rub the thighs, neck, and the upper arms. In this specific type of massage, we treat the body as a whole. In classic massage, for example, we massage one part of the body for example, the leg. Here, we relax the entire body. During this massage, you may want to turn on relaxing music or, for example, sounds of nature. You may also want to add a pleasant aroma to the room. The lights should be dimmed. You may also want to cover the blinds. Make circular movements on the back. Repeat the horizontal and vertical shaking motions on the back. Then stroke the legs together with the buttocks. Remember to avoid the fossa of the knee. The warmth from your hands should spread over the patient's body. Repeat this procedure for the other leg. The hand that is not massaging must always be on the patient's body. Make circular movements when stroking the buttocks from the center to the outside. Stroke both lower legs. This is best done at the patient's feet. Remember not to get too tired while massaging. It is better to use the strength of your body and not just the strength of your hands. Adjust the massage table for the patient according to your height. Just as with massaging the buttocks, it is always to relax the leg muscles. We smoothly stroke the entire lower leg. Make the shaking motion on the legs lengthwise and crosswise. Also do this on the buttocks. First massage one leg, then shake it out. These vibrational movements differ in the amplitude of their movements. While shaking is wider movement, vibration is more localized. The hands vibrate gently. We can use vibration in massage, but shaking is the more pleasant movement. In this way, we finish the massage of the back part of the body and start the massage of the front part. The patient must lie down on their back. Apply the massaging oil with the addition of essential oils. We rub in a star pattern horizontally, vertically, and diagonally. Then we stroke around the navel and stroke crosswise over the abdomen and lower chest. Now rub the thigh muscles. Then rub the calves. Don't forget about the feet. Feet are usually cold. When we rub them with warm hands, it's a very pleasant feeling for the patient. Rub the lower leg. First rub the calf, then massage the entire area. Add more oil if needed. Massage the arms and stroke them. Transition smoothly to the legs. Make the shaking motions. Don't do this right away, but only after the patient's body is relaxed. Stroke the upper part of the chest together with the upper arms. Stroke the entire front part of the patient's body. You may use your forearms when stroking here. This is often overlooked. This is an especially pleasant movement felt by the patient. Now stroke the back and sides of the abdomen with the palms. A large portion of the massage is devoted to the abdominal muscles. This is where stress is located. Shake the abdomen and lower chest. Shake the legs with the technique shown in the video. Massage the entire leg. Then transition to the upper body. Massage the abdomen and lower chest. Massage the entire leg. This massage consists mainly of stroking and shaking motions.